So, welcome. We're talking about the Mantoux test, and this is a tuberculin skin test. So, with the Mantoux, we use a purified protein derivative, which is derived from Mycobacterium tuberculosis, and it's an intradermal injection. So it's put in the skin, and it's a delayed hypersensitivity reaction. So it's a cellular T-cell mediated hypersensitivity reaction to the purified protein derivative that we have injected intradermally. And so because it's a cellular mediated and delayed hypersensitivity, it peaks after in 48 to 72 hours. So the T cells they induce induration. So induration, this is what is important to know, that after the injection of the purified protein derivative, there will be induration. So you administer 0.1 mils of purified protein derivative intradermally and read it in 48 to 72 hours. This is injected on the left forearm. So you put on the left forearm the volar aspect and 5 centimeters from the cubital fossa, and then so the reading, when you are reading, you measure the induration. You don't look at the erythema, but you measure the induration, which is more like the swelling. Okay, so the induration, this is the key word, is what you measure, and you measure the transverse diameter to the horizon, the transverse diameter to the long axis of the forearm, and you record that diameter in millimeters. Then the interpretation of the Mantoux. So a Mantoux depends with the different settings. It can be positive for some patients at 5 millimeter, for some at 10 millimeter, and for some at 15 millimeter. There's a video on when is it positive. But if a Mantoux is said to be positive, this Mantoux test, it doesn't. What it means is that it tests the degree of hypersensitivity to tuberculin. So if someone has a positive Mantoux, it means that they are hypersensitive to tuberculin. And this just tests previous exposure to TB. It does not imply current infection. Okay, so it is for what we use to determine if there is previous exposure. Okay, so if a Mantoux is positive, we say it's previous exposure of TB. But in some cases, instead of induration, you can see that the Mantoux can have vesicles, bullae, or it can have necrosis. And this is typical of a Mantoux. And in those cases, it may imply current infection. So a Mantoux is negative, and there's a criteria for when we say a Mantoux is negative, there's a different video for that. But if we say the Mantoux is negative, it means that the patient has not been infected by TB before, or that the patient infection is very recent. Usually, if it's within 8 weeks before after the infection, there is always known as a window period where the patient may still test negative because the body has not yet responded to the infection. There is what is known as the booster effect of a Mantoux, and this is occurs when in a patient that is previously exposed to TB long ago, if the immunity is boosted, it reacted hypersensitivity to Mantoux, but at some point, then that immunity had waned and it's no longer reactive. If you give them the first dose of a Mantoux on the skin, they may not react, but when you give the second dose, they may react because the first Mantoux activates the body's hypersensitivity. Then a Mantoux can have what is known as Mantoux reversion or conversion. Okay. So reversion, this is when a Mantoux that was previously positive becomes negative. And the rate of Mantoux reversion in people that have positive Mantoux is about 8% per year. And then conversion is when a Mantoux that was negative tests positive within 2 years. Okay, so I'm just this is important for if I'm going to explain here that Mantoux is not recommended in children less than 12 weeks, and in children less than 12 weeks, this is because they don't have their immunity has not yet developed fully. Their cellular immunity is still underdeveloped. So there are a lot of false negatives under 12 weeks. But if you have a positive Mantoux in a patient that is less than 12 weeks, that is a very important test. It is very much towards TB. Okay. Then a previous TB disease, if a patient has a previous TB disease, remember I said that the rate of reversion is about 8% per year. So most patients will still be positive for Mantoux because their Mantoux hasn't reversed. Then for past Mantoux, if your Mantoux was previously more than 15 millimeters, or if it was previously positive, repeating a Mantoux may still be positive because it may not have reversed. Thank you.